This is Dr. Carlos Moreira, and I am a orthopedic surgeon working at Jackson Hospital in Marianna, Florida. And this is a redaction of a presentation that I gave to my Congressman, the Honorable Dr. Neal Dunn. He's representing District 2 for the state of Florida in the House of Representatives in Congress. This presentation was given to Dr. Dunn on July 9th of 2020. I thank Dr. Dunn for his service both in the U.S. Army as well as in Congress. I also thank him for coming to Marianna to visit the city and the county, and for coming to my office with his staff for this presentation. I have no disclosures. I have no stocks in healthcare companies or any food companies. My presentation will be as unbiased as possible. My views are my own. They're not necessarily that of my employer, Jackson County Hospital District, or of the U.S. Navy, since I'm a reservist in the United States Navy Reserve. The topic of discussion was chronic diseases, insulin resistance, and the USDA Dietary Guidelines that are currently being revised. These get revised every 5 years. So why this subject? Well, chronic disease is the number one cause of morbidity and mortality in the United States. And this data right here is straight from the CDC website. Obviously, no need to explain this. The risk factors as listed in the CDC are the following: cigarette smoking, lack of physical activity, excessive alcohol use, and poor nutrition. I would agree with all those four, except that to some extent I would actually disagree with all of these right here. Blaming poor nutrition on diets low in fruits and vegetables are probably not low, and maybe for the fruits are probably fairly high. High in sodium, the blame really belongs more to insulin. High levels of insulin will stimulate the kidneys to retain sodium. And saturated fats, which the poor saturated fats have been blamed for decades based on very poor epidemiological data. This is a graph showing the increasing incidence of diabetes in the United States, but basically a similar graph could be presented for many chronic diseases, including autoimmune disorders. Since the 80s and 90s, these have been going pretty high in the United States. And the amount of money that we spend in chronic diseases and mental health conditions is just astronomical. About 90% of the nation's $3.5 trillion in annual healthcare expenditure were on these conditions. And this data is from 2017, which is the latest that was available on the CDC website. The problem with chronic disease is really a problem of metabolic dysfunction. More precisely, insulin resistance. It has been found that about 88% of the U.S. adult population has some sort of insulin resistant or metabolic dysfunction. And for adults that are at least 60 years old or older, that rate is 98%. This is almost all of them. And this is really all caused by the standard American diet. Now, for years, the blame has been placed at the feet of saturated fats, basically animal fats. Back in 1967, a few researchers were paid money by the Sugar Research Foundation to publish a review that would be favorable to sugar, downplay the effect of sugar, but to blame saturated fats. And of course, this wasn't disclosed in New England Journal of Medicine. When this got published at that time, it wasn't a requirement to have financial disclosures at that time. And we also know about the this U.S. Senate Select Commission Nutrition, basically the McGovern Commission, and the work of Ansel Keys of cherry-picking data based on pure epidemiological studies, blaming saturated fats. So I think this really reminds me of the words of Surgeon Captain Cleave from the Royal Navy, who said that, to blame modern diseases on an old-fashioned food, like eating meats and so forth, is one of the most ludicrous things I've ever heard. It doesn't make sense, apart from the fact that the scientific scrutiny isn't there to blame saturated fats. But going back to insulin resistance, basically there's a linear correlation to visceral fat And that it's been found that they can lead to heart disease, breast cancer, many forms of cancer, prediabetes, type 2 diabetes. And since Dr. Dunn is an urologist by training, I show him these slides basically telling him, I didn't know these things up until like about 2 months ago, that high levels of insulin can also be related and can be a cause of benign prostatic hyperplasia. I'm an orthopedic surgeon. I don't normally read papers about BPH. So that was news to me. Insulin resistance has been associated with cardiovascular disease. In this study, which they took 3 groups of, quote unquote, healthy, non-obese men, adults, and then they separated into 3 different groups. The one that had low levels of insulin or insulin sensitivity, and then those were kind of halfway in between, halfway through in terms of insulin resistance, and then those that had a lot of insulin resistance, and they followed them for 5 years, and with the ones with insulin resistance develop high levels of cardiovascular disease. Mathematical study here showing that the most common risk factor for heart disease is insulin resistance. Why? Because not only are the numbers fairly high, 42%, but also insulin resistance can lead to many of the other risk factors, such as elevated systolic blood pressure and so forth. Here's a study looking at healthy individuals ingesting different type of diets, and they found out that those who were given a carbohydrate-rich diet, not only they have their spike in sugar, but they also have this spike in insulin as well. And these were healthy individuals. And what does it all mean in COVID-19? Well, data published in the Morbidity and Mortality Weekly Report of the CDC back in April showed that 90% of the hospitalized patients had at least one comorbidity. Most common one being obesity, but also included hypertension, COPD, chronic lung disease, diabetes, and so forth. At the other end of the spectrum, when you take a healthy population, such as the USS Roosevelt aircraft carrier, when it had an outbreak in the Pacific, when they started testing all their sailors, they found out that about 60% of the carrier's infected sailors really had no symptoms, because they were dealing with a young, healthy population. So the biggest lesson that I've learned since I graduated from medical school in the 1990s has been a shift in the paradigm about thinking about chronic diseases. Back when I graduated from medical school, it seemed to me like type 2 diabetes, just like essential hypertension, these were conditions that were treatable and manageable. But that, you just unfortunately get them as you get older. You just get them for no reason. People might say, well, diabetes runs in my family. And believe me, when they say that, they mean type 2 diabetes. They're not talking about anything else. And if at that time, if a patient had a mild hyperglycemia or a mild form of diabetes, then you try to treat it with dietary changes, whatever that meant back then. Back then, it was probably a low-fat diet, trying to lower cholesterol, eating margarine, all this stuff that we wouldn't do today. But if the level of sugar was high or if the blood pressure was high, then you have to really resort to medication. For diabetes, you resorted to oral hypoglycemic agents and then insulin for rescue. The new paradigm is just different, and it's the realization that type 2 diabetes is preventable, is reversible, perhaps not the end organ damage, but the disease process is reversible and you can put it in remission. The same thing for essential hypertension. There's really no reason why it should be called essential hypertension. It should be called dietary hypertension because it's caused by diet, just like type 2 diabetes is caused by diet. So we need to stop thinking about these conditions being treatable or manageable and to start thinking about them about being preventable and reversible and placed into remission. So here are some success stories on the benefits of a low carbohydrate diet with the elimination of processed foods in reversing insulin resistance. Now, insulin resistance has been found to be linearly correlated with visceral fat. Here you have a 68-year-old gentleman who stopped eating processed foods, and that was it. He didn't exercise for 1 minute, no other dietary changes, no counting calories, and in a matter of 35 weeks, not only lost a lot of the subcutaneous fat, which is the fat in yellow here, as you can see on this MRI scan of the abdomen, but he lost a lot of the visceral fat, which is here depicted in red. This is that fat that surrounds our abdominal organs. This is implicated in heart disease and other conditions. And this was without any exercise. Here's another one. A 58-year-old gentleman with a left middle cerebral artery occlusion was placed in a low carbohydrate ketogenic diet, high fat, with some intermittent fasting and sprinting. And in a matter of 9 months, this individual who had a complete occlusion of the left middle cerebral artery, that artery became wide open. This is with no medications, no catheterization. This is the key of the reversal of chronic disease, being able to get changes like this that you can verify, objectively verify, with clear changes on an angiogram with no medication. Even up my alley, basically in orthopedics, low carbohydrate diet on a pilot randomized controlled trial was found to be better at reducing pain, including functional pain in knee arthritis. This was a pilot study. I've actually corresponded with the lead author of this paper, and they will certainly would like to do a bigger study, but they're trying to obtain funding for a larger study. But this was just published earlier this year. So what do the U.S. Dietary Guidelines mean to us here? Well, they may not mean much to me because they don't have an effect on my diet, but they certainly have a huge impact in the diet of the United States. Why? Because they affect the menus of hospitals, school lunches, long-term institutions such as nursing homes, the military, at the dining facilities, and prison menus. And there are supposed to be recommendations to all Americans, but they're supposed to be recommendations for all Americans, not just those that are metabolically healthy. But as we have already discussed, 88% of the U.S. adults are not healthy. So the root cause of problem of the dietary guidelines are basically twofold here. There are many other things that need to be corrected, but these are the two biggest ones in my opinion. Number one is that the current guidelines recommend that 45 to 65% of the calories come from carbohydrates, even though carbohydrates are not an essential macronutrient. There is such thing as essential fatty acids. There is such thing as essential amino acids. There's really no such thing as an essential carbohydrate. And the second one is that I recommend low amounts of saturated fats, basically mainly from animal fats, to less than 10% of the calories. As a result, they recommend that you need to supplement with like a certain type of polyunsaturated fatty acids, which we'll discuss in a second. So now the dietary guidelines are currently being revised. The problem is that the latest research is not being considered. They have an unverified methodology for reviewing this as scientific papers, and they're just following weak epidemiological data, just regurgitating recommendations from previous committees. They've excluded almost all studies on low carbohydrate diets. They have excluded all studies on weight loss, and they continue to recommend saturated fatty acids to be less than 10% of the caloric intake. And get this, they recommend equal amounts of refined grains as whole grains. Why in the world would they recommend refined grains when they can elevate and spike your sugar? And they know that. Well, they do that because refined grains are enriched and fortified in order to make up for the deficiencies from having a diet that lacks in saturated fat. So they're trying to circumvent the problem that they're creating in the first place. Some of the reviews are only as recent as 2016, even though many papers have been published since that time. This is despite the congressional mandate from 2015 that the literature review needs to be current. There's also allegations of not having enough time for the committee to do its work. And this committee's report is scheduled for release by the USDA and HSS sometime in the next few days for public review. Why do they continue with the vilification of saturated fatty acids? Well, this is basically based on poor epidemiological data. Okay, studies going back decades comparing diets that are plant-based versus animal-based and looking at basically mortality and disease. Well, you can't really up until just recently, I mean, anybody eating a carnivore diet which is be somebody who just eating anything. So they will have a hamburger, but sure, the hamburger comes with a bun, which has polyunsaturated fatty acids, which has sugar, which has refined carbohydrates, refined grains. It comes with the ketchup, which is also sugar. It comes with the fries, which is more carbohydrates, which were fried in polyunsaturated fatty acid vegetable oils, which are highly inflammatory. And then it comes with a big soda. Well, in a diet like that, don't blame the meat for the heart disease. I mean, look at all these other factors. So it's really very difficult to control such studies. And yet, when you have randomized controlled trials comparing polyunsaturated fatty acids with saturated fatty acids, it appears that then the polyunsaturated fatty acids increase the risk of cardiac events and increase the risk of death. Yes, they can get your cholesterol lower. They will also increase your chance of death. So good luck with that if you're just looking at cholesterol as the only end result here. This is both true for the Minnesota coronary experiment, which took about 16 years to get published, and then it was not published in its entirety, and also true for the Sydney Diet Heart Study, which took about 40 years to get published. Why? Well, the researchers or the funders of the research were not happy with the results originally. But it took for Charles Ramsden at the NIH to dig the data and to publish it in its entirety. More recently, the Journal American College of Cardiology, a state-of-the-art review, just last month, basically saying, listen, looking at the totality of the information, of the available evidence, we can't really support continuing this limitation of whole fat dairy, unprocessed meats, eggs, and dark chocolate. It's from American Journal of College of Cardiology. So where do we start making changes at these institutions that are influenced by the U.S. Dietary Guidelines? So let's look at hospitals. Here's one study, for instance. Randomized study, a low carbohydrate in the ICU setting. Patients who were on ventilators were able to come off the ventilators 62 hours earlier on average compared to those who had regular feeds. For pregnant women, after 16 weeks of gestation, they require a diet that is higher in protein for the rest of gestation. Oftentimes, common deficiencies of prenatal vitamins are related to nutrients that are found in animal-based foods. Also, low carbohydrate diet in pregnancy can lower the incidence of infant obesity if the mom was on a low carbohydrate diet during gestation. In schools, study by Dr. Lustig showing that just in 10 days you can improve metabolic parameters such as lowering blood pressure, more weight reduction, better insulin levels, and glucose tolerance with a diet, isocaloric diet that is restricted in fructose as opposed to not having a restriction to fructose. These are metabolic parameters that improved in just 10 days. Now imagine the implications of this in COVID-19, when we're going to have the virus with us for months, and who knows if it'll be more than a year. It could very well be longer than a year. And yet you can, in just 10 days for adolescent obese children, you can improve their metabolic parameters in just a matter of a few days. Where do we start for long-term care institutions? Well, studies are showing that the dementia is related to high levels of glucose, even in those patients that are not diabetic. Some people even called Alzheimer's disease type 3 diabetes for that reason. So the worst that we can be given to our elderly folks in the nursing home are cookies and juice. Where do we start in the military? Well, military follows USDA guidelines at the moment, but a recent study just published last year showing that ketogenic diets showed remarkable weight loss and loss of visceral fat in military members without compromising physical performance. Where do we start with the prison system? Well, prison systems do have a high incidence of mental illness, and yet studies are beginning to show that there can be an improvement in schizophrenia with remission of psychotic symptoms on patients on a ketogenic diet. So what we're asking the Agricultural Committee in Congress is to have a closer oversight of the USDA Advisory Committee revising the guidelines, that they stick to the mandate from Congress from 5 years ago, to more closely vet the papers and to include all the recent data. We also asked them to more closely vet the committee members to avoid those with a conflict of interest. And about half of the members on the current USDA Advisory Committee do have a history of conflict of interest, whether it be getting paid by a food company or a pharmaceutical company. And that they fund nutritional research that is performed by unbiased scientists with no personal agenda, with no financial agenda that will skew the results, and definitely not funded by big food or by pharma. And then a bigger awareness of what the implications of having metabolic health mean in the era of COVID-19. So in summary, chronic diseases are not just treatable or manageable, but they're preventable, reversible, and they can be placed in remission. And the USDA Dietary Guidelines could play a key role in helping us achieve that at different institutions in the United States. Thank you very much for your attention. I hope you enjoyed this presentation.